Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your question on injuries, training, rehab, or technique. We'll be taking your phone call shortly. Call 856-767-8884 or toll free 888-634-7488 for your direct line to Sports Doctor. Now here's your medical reporter for tonight's show, Joe Chapana.
All right, good evening and welcome to Sports Doctor. We're brought to you by Cross Keys Physical Therapy, Sports Medicine Center in Sicklerville, Woodbury, Washington Township, Pennsville, Swedesboro, and Vineland. And you may have heard they're offering free screenings for the next 2 weeks. To take advantage of that offer, we'll give you numbers to contact their various centers near you. Right now, though, we are going to be giving you our number to contact us directly. It is 1-888-634-7488. Locally, it's 856-767-8884. Sports Doctor, tonight we're going to be dealing with general sports injuries, and also we're going to talk about the increased use of performance-enhancing substances in adolescents. And with us tonight to take your phone calls, we have Dr. Rob Franks. Dr. Franks is a medical orthopedic and sports medicine physician with Cooper Hospital, University Medical Center, Bone and Joint Institute. They're located in Camden, Voorhees, Cherry Hill, and Newtown Square, Pennsylvania. Next to him is Dave Anselmo. Dave Anselmo is a physical therapist and owner of Cross Keys Physical Therapy. Welcome to the program, gentlemen.
Thank you.
Thank you. And Dave, we'll start with you. I mean, we talk about exercise, the need to focus on a subject that has been extremely talked about, and that, of course, is the ever-increasing use of performance-enhancing substances and anabolic steroids in sports. Why do you think there's a rise in the use of these drugs?
I think it's a great subject because you hear so much about it now with this Barry Bonds thing and everything. But I think the reason you see it, starting from a lower level, which is, I think it's the high competitiveness in high school sports. Everyone's trying to make the team, and some people maybe just aren't good enough to make the team, and they need that little bit of edge to make the team. It's such a popularity thing, so they might take a steroid just to make the team. And some people that are on the team that never took them, that might need to take that next edge because their dream is to play college baseball. And taking that edge, taking that steroid might enable to them to get that power, the strength, and the endurance to maybe take them to the next level. And then that's at the college level. And at the college level, they look up to the pros as their heroes. And you're seeing people like, obviously none of these players are saying they do, but we look at them and we have a good idea that we think some of the people like the Bonses and the Sosas and who else? Canseco and the other guy that hit all them home runs. McGuire, right? Oh, they all took them, so they look at them. It's okay for them to take them. So I want to make it to the pros. So maybe if I take them, maybe I'll make it there. And then from the pros, they're taking them obviously for monetary reasons. They break a lot of records. They want to sign big contracts, and it allows them to endurance and maybe play a little longer. So there's a lot of positive things with that. That's on the athletic side. Now, from the non-athletic side, I think it's just the body image. I mean, in high school, you want to look the best you can. You want to look good, look big, and you show the muscles, and the girls like it. So I think it's a lot with the body image, like the doctor and I were talking about that. We think that's probably even bigger than the athletic part of it. It's a real big problem nowadays. So I think those are the things. I think it's really good to see people like Jose Canseco come out and talk about some of the negative sides of steroids, because all along, no one wants to admit they're doing them, and we know the positive sides because we see what's doing it for, but no one really talks about the negative sides because no one wants to admit they're doing them. So I think it's really good that you see people like Jose Canseco kind of blowing the whistle and talking about the negative sides. But I think it's important because the negative sides are things that they really can injure you later, long term. And I'm hoping tonight's show, you'll hear a lot from Dr. Franks talking about some of the negative sides, and we'll learn a lot about that tonight.
Well, Dr. Franks, let's start. What are anabolic steroids?
Anabolic steroids are a testosterone-like compound. There's a process that your body takes to convert cholesterol down to testosterone, and at each step there's a compound made. Some of these compounds essentially we use as the performance-enhancing drugs. Like andro is the step before steroid production, and DHEA is 2 steps before that. Up until about a year and a half ago, andro was available over the counter from like your GNC or Vitamin Health Center, what have you. And basically, they've taken that off, but DHEA is still in there and still available to be used. So we worry about the side effects from all of these compounds. The anabolic steroid itself acts like testosterone, But it also gives you the same side effects as testosterone. The problem is those other drugs do the same thing, even though they're quote-unquote legal and people have the ability to go ahead and buy them. But what they do is once they get in the body, they essentially do a lot of the things that we see and expect the steroid to do. They make the body bigger. If it's a sport where you want more aggression, it makes you more aggressive. The thing that we don't count on is the side effects. Increased blood pressure, acne production, shutting down of the body's natural production of testosterone, the testicles shrinking. And one of the bigger categories of users that we really don't even talk about, and even we were talking about beforehand, but we didn't talk about it in the introduction, is women. There is a lot of women who are using it not only in sports, but also because of the body image issue. The women, because steroids are so good at decreasing the amount of body fat and giving you a lean body image, women are probably the largest group of new users as compared to traditionally the male users.
Well, let's talk about the signs associated with a person who is using anabolic steroids. Maybe a parent concerned about a teenager using them. What should they look for?
Obviously, you're looking for, first and foremost, a change in the body habitus itself. You have somebody who leaves school that year at 150 pounds and comes back at 185 pounds and they are rock solid muscle. Now, granted, there's people who are going to have some gains. We're not saying that every person who over the summer goes and lifts weights and does a workout program isn't going to get bigger. But there's some other things that you want to look at in association with that. One is, of course, a change in the attitude, change in behavior, more aggressive, more violent. The action and reaction to normal everyday things change, becomes a little bit more hypersensitive to things. There's also more physical evidence that you can look for. Acne production, and it's not just in the face that we think about with typical teenage acne, but it's all over. Some people end up getting male pattern baldness earlier, starting balding right on the top and spreading out. We also, another thing that we look for a lot of time is that women get more masculine characteristics. They lose breast tissue, voice may deepen a little bit, and guys, even though that they're looking for the, looking to be quote-unquote jacked up or ripped up, guys can end up having female characteristics, getting actually what's called gynecomastia, or looks like breasts that a female would have.
All right, let's interrupt for just a second, go to the phone lines. I believe we have a caller from Pittman. Michael, you're on Sports Doctor. Thank you for the call. Thank you for watching. What can we do for you tonight?
Hey, how are you doing tonight?
Good.
That's good. I was a runner in college, and I had, after I finished my career, I had patellofemoral disorder, and I had a lateral release done. And my question is, I've been to a lot of different physical therapists and different doctors, and I've heard differing opinions on whether or not you can isolate the VMO. I think that's what it's called.
Yes, you're right.
And now, some say that you can, some say that there's no specific exercise.
Can you isolate that? I've never.
Yes. Yeah, you can. Yeah, there are specific things that you could do to isolate the VMO, which is the medial aspect of the quadricep musculature. You want to pull that patella more immediately because it's tracking laterally, and you isolate out the vastus medialis, it's called, and you can isolate that out. The specific exercises you could do, there's actually different, there's a Russian stim you could do as well to isolate that out even more to make sure you're doing it properly. But there's definitely things you could do to isolate out the VMO. I don't know if you want to add to that.
Yeah, one of the things I tell people with patellofemoral syndrome is that when we send them to physical therapy, they'll come back to me and they'll have done phenomenal. They'll be doing great, they'll be feeling good, and then they stop. And they go back to their activities and they end up having the same symptomatology again. I try and tell people what happens is your kneecaps, for lack of a better term, are riding a little too far to the outside. We're trying to bring them in a little bit more to the inside. So we want you to isolate that inside part of your quadricep muscle. We tell you to do kind of like the old style leg lifts. We call them quad sets. When we isolate out when you're doing leg extensions in the gym at like that last 45 degrees without locking your knee. These are some of the things that isolate that out. But it needs to be done on a consistent basis, because once you stop, and we were talking about, quote unquote steroids and building up your body. Once you stop taking the steroids, your body goes down, or if you stop lifting, your body goes down. The same thing happens to the muscle with patellofemoral syndrome. Essentially, the muscle weakens again, the caps flop back out to the outside, and you're right back where you started from.
It's very true. And I think another thing to add to that is it's usually caused from things, for example, you say you're a runner. It's a lot of times it's caused because you're running in a certain way, or it's improper shoes that you're using, or you're running in one direction, switch up directions, and lack of stretching. So these are things you need to do to work on the VMO, but not only do you continue to work on the VMO, if you don't do the continuing exercises and you go back and doing the activities that caused it from the beginning, even though if you got the release, a lot of times the tightness coming on the outside could happen again because of the fact that you're doing some of the things that caused it from the beginning and not doing the strengthening that prevent it from happening again. So as Dr. Franks likely explained, it's real important that you continue to do the exercise. I see it time and time again, and that's when you see the patients come back returning in 6 months to 9 months, and we have to start all over again. So it's real important that you continue to maintain and do these exercises again and again.
All right, Mike, thank you for the phone call. Thank you for watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Joe from Sewell is our next caller. Joe, you're on Sports Doctor. What can we do for you tonight?
Hey guys, this is Joe from Sewell. I'm a jockey at Philadelphia Park, and I had an injury of approximately 8 months ago. I had an L1 burst fracture, and I'm doing quite well. I just graduated Cross Keys Therapy over here in Turnersville, and I'm looking to get back to work. And I currently know 3 riders that are riding now with rods in their back. I have 2 rods and screws. And my question was, do you guys suggest that I get the rods out before I go back to riding, or leave the rods in and continue on?
Rods in or rods out?
You want to take it?
Sure. You know, one thing that we should talk about is spine surgery. Whenever that the spine surgery is done, you know, we're always concerned about, you know, recovery and rehab. Okay, the first thing that you want to consider is how you're feeling when you're back doing what you're doing. A lot, you know, just to use an example, is Gloria Estefan, was the singer from Miami Sound Machine, was basically in a bus accident years ago, and she still has the titanium rods in. She's able to perform, she's able to do aerobic type concerts, and she doesn't have any kind of a problem. And you're gonna, you know, I certainly don't do spine surgery, but from what I understand, it's basically how you're feeling in terms of doing what you're doing, and making sure that there is no neurological events happening when you're doing your activities, making sure pins and needles aren't coming back or pain, and then you have to take that up with your physician and really talk to him about what's good for you or what's not good for you.
Joe, thank you for watching. Thank you for the phone call. I don't know that jockeys use steroids. Probably more the horses.
I think one thing I'd like to add about that last thing with the jockey, I think it's really, really important, more important to him because he's so active in doing the jockey where you're doing a lot of compressive activities that he must, I mean, absolutely no question about it, he must maintain his core musculature to maintain this, because we need to take the stress. We don't want the stress to even get close to hitting that spine again. So we need to strengthen the back extensors and abdominals for here on out. It's got to be a everyday thing, and he's got to maintain his flexibility if he wants to continue to do that thing, because you don't want the stress to go back on them rods again. And if he stops doing those things, he's going to have a lot of problems.
All right, there you go, Joe. We're going to take a short break. You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy. Our lines are open if you have questions tonight. We're talking steroids and also general sports injuries. Our toll-free number is 1-888-634-7488. More of Sports Doctor right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The Rothman Institute, the #1 orthopedic care team in the region. Freedom of movement at any age.
Great, Grandpa.
Call 1-800-321-9999.
All right, you're watching Sports Doctor. We're brought to you by Cross Keys Physical Therapy Sports Medicine Center. They are offering free screenings for the next 2 weeks. At the end of the program, we'll give you the numbers for their various centers. Tonight, we're talking steroids and also general sports injuries. Answering your questions tonight, we're pleased to have Dr. Rob Franks. He's a medical orthopedic and sports medicine physician with Cooper Hospital, University Medical Center, Bone and Joint Institute. And also Dave Anselmo is with us too, physical therapist and owner of Cross Keys Physical Therapy. Again, the numbers 1-888-634-7488, a local number 2-856-767-8884. Dr. Franks, what are the current laws and regulations in place to reduce the use of anabolic steroids?
Well, the steroids themselves are pretty much banned in the United States. They're also banned in the NCAA. They're banned by the International Olympic Committee. So right off the get-go, steroids are pretty much out as far as legality is concerned. The problem right now is what we're going to do with the rest of the quote-unquote performance-enhancing substances. And right now, as we said earlier in the program, that andro, which is one of the precursors, has just been made a scheduled drug, so you can't get it without a doctor's prescription. The interesting thing now is not, I think, not so much the legalities from a legal perspective, but what's being done in each particular league or in each particular sport, and seeing the jockeying and the politics that's playing out. I mean, baseball's a perfect example. Mm-hmm. You know, the self-governorship has not really worked, and it's going to be interesting to see as time goes on exactly what the final outcome is going to be with the congressional investigations that are going on.
Yeah, more to be determined. Our toll-free number, 1-888-634-7488. Let's switch gears and talk about overtraining and exercise. Dave, what are some common injuries that you see people doing when they overtrain?
Well, there's two different ways. If you're talking about someone overtraining that's been on anabolic steroids, we're seeing a lot more people with musculoskeletal problems that have been on steroids because the muscles are growing so big, and you know that we're having tendonitis problems because we know that the strains are basically injuries from the tendon, and the tendon attaches the muscle to the bone. So when the muscle expands so big, the tendon can't withstand that strain. The overload of it just can't do it. So you're seeing tendonitis a lot with people that are on steroids because the tendon can't withstand it. And just in general, overtraining, if they're not training properly, I think it's a real important part, I think, with training is that the people that haven't been training or never trained before, that I really, really, truly believe they need to get a personal trainer to learn how to train properly, because it's so important. Technique is really what it's all about. It's not how much you could do. It's not, it's how you do it properly. And I think you need to learn that from the start. Like anything else, you need a base, and you need to start right in order to do it properly. And you need to know what your goals are. Mm-hmm. So some people just jump in and do that. So if you're doing those things, you're not going to have problems of overtraining. You're not going to have these tendonitis and stuff like that because you're learning the proper way of lifting, and you have certain goals. And I think personal trainers will help to keep you on track to reach those goals that you want in a proper fashion, and the most important thing, in a safe fashion.
And personal training services available at most gyms, so it's something you should probably take advantage of, especially if you're just beginning a program. Our toll-free number, 1-888-634-7488. We have Mike on the line from Washington Township. Mike, you're on Sports Doctor. Go right ahead with your question.
How you doing tonight?
Good.
Good. I have a 15-year-old son who was diagnosed with a strain to his, I think I'm pronouncing it right, the brachialis muscle in his pitching arm.
Okay.
And there was no cartilage damage or anything else like that. I'm just asking if you guys are familiar with that and how long that takes to rehab.
Okay. Anybody want to take that one?
You said the brachialis muscle, is that correct? Basically, the brachialis muscle is one of the muscle that's going to help with your process of pitching, essentially. There is an actual sequence of events that the body goes through in terms of cocking the ball, accelerating through, and releasing the ball. And the brachialis muscle is basically up in this area, right up in here. Provided there's no tendon damage, provided there's no tearing in the muscle, it's something that you could definitively rehab. The important thing is to be well rehabbed, because if it is a pitching arm, you start worrying about the number of pitches that are thrown and the way that the actual pitching technique is going to change, because there is a problem within the muscle. So you want to make sure that you're rehabbed properly, that you're back that you've gone through a throwing program before you actually get back up on the mound, because what's going to happen is if you don't get through the entire rehab stage, you're going to end up starting right back onto the same path that you were on, start right back on with changing your pitching process, because you're going to be in pain again, and you're right back where you started from.
Is that a common thing you see with pitchers, Dave?
I think it is. I think the important thing, is that, as Dr. Franks was talking about, is that you first you get it assessed first. I mean, you get it checked by your doctor, orthopedic surgeon, see how severe it is, and you get it corrected before you try to go back and do anything. But the most important thing I think it is that someone that's really serious about that is really it's the preseason. It all starts from preseason. You need to be able to train for your sport, and in that training is a lot of it with body mechanics. You need to make sure you're stretching properly. You need to make sure you're doing your strengthening stuff. You're not overtraining, you're stretching properly, and you're working on your body mechanics of pitching preseason. So when the season comes along, it's not a trauma to that muscle, you know what I mean? And your mechanics is probably off. If he's having problems with his arm this early in the season, it's probably because his body mechanics are off. So if he gets it corrected, if he goes to a physical therapy center and they get rid of the pain, well, it's probably going to come back again if he has bad body mechanics. So you need to go somewhere that knows about pitching and that can talk about body mechanics and to get that corrected before he goes back out on the mound.
All right, good advice there. Toll-free number 1-888-634-7488. Let's talk to Tom in Haddonfield. Tom, you're up on Sports Doctor. Your question tonight.
Hi, I was just wondering.
I think we lost Tom in Haddonfield. I want to remind viewers that if you're looking for a free evaluation, it's being offered by Cross Keys Physical Therapy Sports Medicine Center. Free screenings for the next 2 weeks, and at the end of the program, we'll give you numbers to take advantage of that offer. By the way, Dr. Franks, is there a location on the web, perhaps, that coaches or physicians could get more information about detecting the use of steroids in their players or children?
Actually, there's a lot of good sites on the web. You basically can go onto Google, and if you put in anabolic steroids, they're usually the first or second link to come up is the actual National Institute for Health and the federal government website. Sometimes that's a little bit technical, but they have links to different high school authorities, such as the National Federation of High School Coaches. They have information on there. Even the state of New Jersey's own website has a lot of information on this, considering the fact that New Jersey last year had the governor's task force on steroid use and abuse. And right on newjersey.gov, if you go to the governor's page, there'll be a link to the task force page, which has a lot of good information for the written specifically for the general public and not for the government concerning steroid use.
Okay, check that out. We're going to take a short break. We'll come back with more of our program. We're talking general sports injuries, also steroid use. Our toll-free number is 1-888-634-7488. You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. Stay with us. More of our program right after this.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
The Rothman Institute, the #1 orthopedic care team in the region. Freedom of movement at any age.
Great, Grandpa.
Call 1-800-321-9999.
And we are back. It's Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center. They're in Sicklerville, Woodbury, Washington Township, Pennsville, Vineland, Swedesboro, and also Pennsville. And they're available. They're offering free screenings for the next 2 weeks at the end of the program. We'll give you numbers to take advantage of that offer. Tonight we're joined by Dr. Rob Franks. He is a medical orthopedic and sports medicine physician with Cooper Hospital, University Medical Center, Bone and Joint Institute. Also, Dave Anselmo is with us, physical therapist and owner of Cross Keys Keys Physical Therapy. And Dave was talking about spring training, and for a lot of us, this is the time when we first start exercising and shaking off a lot of the cobwebs of winter. Is it normal to feel some soreness from this inactivity, Dave? And when can you tell if the soreness is a problem or just normal?
No, it is normal to get soreness. Believe me, if you haven't been exercising for a long period of time, it's normal to get a soreness for a week after you do the training. And I tell people, anytime after 10 days after training and you're continually training, if you still have soreness that seems to be less than it was in the beginning, you're okay as it's going down. But after 10 days, if the soreness continues to go up, then you're doing either you're overtraining or you had an injury and you need to look for something else. Sometimes I recommend to people that they really don't think they're overtraining, just to shut it down for 2 weeks to see if it goes away, and then to start back up again. But organize a personal trainer to start you out, because you're probably doing something wrong. Have somebody check you out and see what you're doing to set up your program properly, because if that continues to get worse, you're doing something wrong.
Again, the importance of a personal trainer. Now, Dr. Franks, what about if someone has done too much too soon? What can they do to help themselves at that time? How do they get rid of the soreness?
Well, this is the time of year, especially with the high school athletes, that we see a lot of overtraining type issues. People who didn't play a sport either in the fall or in the winter come out for spring sports. And a lot of these are running sports, so we see a lot of people who have gone from 0 to 60, haven't run at all, and now all of a sudden are running in track or running in baseball, and we're seeing a lot of shin splints. And sometimes we see people with plantar fasciitis and so on and so forth. And we basically handle the athletes a lot of the times the same way as we do with the general.
You know what, Dr. Franks, I'm going to have to stop right here because
Sure.
we're completely out of time. I can't believe it. I want to give the numbers out to Cross Keys Physical Therapy Sports Medicine Center. We'll be talking about the free screenings available. There are the numbers. The Sicklerville Center, it's 856-728-1900. Woodbury, 856-853-0988. Washington Township, 856-374-3707. Pennsville is 856-678-8000. Vineland, 856-794-8300. And in Logan Township, Swedesboro, 856-467-9911. I want to thank Dr. Franks for joining us. Again, he's with the Cooper Hospital University Medical Center Bone and Joint Institute. They're in Camden, Voorhees, Cherry Hill, and Newtown Square, Pennsylvania, and Dave Anselmo as well from Cross Keys Physical Therapy. Until next time, I'm Joe Chapana for Sports Doctors. Stay well.